Hi, welcome to the presentation on type 2 diabetes. Today we're going to talk about type 2 diabetes, the definition, the etiology, the prevalence of the disease, symptoms and diagnosis, progression and prognoses, treatment options, the kind of specialists you need for treatment, and psychosocial, spiritual implications, as well as cultural considerations. Now, it's important to note that diabetes is a huge subject, and there are various types of diabetes: type 1, type 2, gestational, etc. So for the purposes of this presentation, we will be covering and discussing type 2 diabetes only. Type 2 diabetes is a disorder of the endocrine system that disrupts the way the body uses glucose or sugar. All cells in the body need glucose to work properly. Glucose gets into the cells with the help of a hormone called insulin, which is produced in the pancreas. In type 2 diabetes, the pancreas does not produce enough insulin, which allows glucose to build up in the bloodstream. The etiology of diabetes is interesting. There are environmental factors that play a role, and there are also genetic factors that play a role. On the environmental factors, what you eat and how active you are, in combination with genetic causes, affect the risk of developing type 2 diabetes. Many people with type 2 diabetes have a family member with type 2 or other medical problems associated with diabetes, such as high cholesterol or blood pressure levels or obesity. There is a lifetime risk of developing diabetes type 2 that is 5 to 10 times greater in first-degree relatives such as mother, father, sister, or brother. The likelihood of developing type 2 diabetes is also greater in certain ethnic groups such as Native Americans, African, Hispanic, and Asian Americans. Now, this is based on the National Health Interview Survey and the 2012 Indian Health Services National Patient Information Reporting System. And as you'll note, that through the different ethnic groups, it gradually increases, starting with non-Hispanic whites at about 7.6%, Asian Americans at about 9%, Hispanics at about 12.8%, non-Hispanic blacks at 13.2%, and the highest percentage of people with diabetes by race or ethnicity in the United States is by far Alaskan Natives and American Indians at 15.9%. The prevalence of type 2 diabetes is huge. It is an epidemic. Currently, as of 2014, according to the Center for Disease Control and Prevention, for the CDC report for diabetes, there are 29.1 million people, or 9.3% of the population, that currently have type 2 diabetes. Of those, there are already 21 million people diagnosed. There are also 8.1 million people, or 28% of the people, known to have diabetes that are technically or officially undiagnosed, and this includes all ages as of 2012. So the undiagnosed are considered folks who go to the emergency room and they may have a secondary diagnosis because their glucose levels are too high or because they're extremely hypoglycemic, and yet they have never seen a physician to have a formal diagnosis of diabetes. So diabetes prevalence changes over time a great deal. And when I talk about an epidemic, it's very noticeable in this next slide. The changes from 1958 to 2009 and the number of people diagnosed with diabetes. In 1958, less than 1% of the population had diabetes or were diagnosed with diabetes. And in the millions, when we're talking numbers, a little over 2 million people in 1958 had diabetes. If you look to today, or to 2010, as of 2010, the percentage of people with diabetes in this country is well over 21 million, or 21%. And the number of people with diabetes in this country is over 21 million, as discussed in the previous slide. So it really has become an epidemic that has changed dramatically in the last 6 decades. The symptoms and diagnoses of type 2 diabetes. Before being diagnosed with type 2 diabetes, most people have no symptoms at all. In those who do have symptoms, the most common include passing unusually large amounts of urine or needing to urinate frequently, which is also called or referred to as polyuria, excessive thirst, also known as polydipsia, and blurred vision. These are the most common initial symptoms that people experience. Some people, however, experience no symptoms whatsoever. And it's not until they get extremely sick and go to the emergency room that they realize they have diabetes. There are laboratory tests. They're usually the primary test for diagnosing diabetes, and there are several. There's the random blood sugar test. That means you can have your blood drawn at any time throughout the day, regardless of when you last ate. And if your blood sugar is 200 or higher, you have the symptoms of high blood sugar, and it's likely that you have diabetes. There's a fasting blood sugar test. A fasting blood sugar test is a blood test done not after eating. You have to fast for 8 to 12 hours, generally overnight, and a normal fasting blood sugar level is less than 100. There's a hemoglobin A1C test, and this is a term you're going to hear in clinic a lot. The A1C blood test measures your average blood sugar level over a period of 3 months. So normal values for an A1C are 4 to 5.6%. Now this test can be done at any time of the day, and you don't need to be fasting. There is also the oral glucose tolerance test. Oral glucose tolerance testing is a test that involves drinking a special glucose solution. Your blood sugar level is tested before you drink the solution, and then again 1 to 2 hours after drinking it. Diabetes can affect many parts of the body, and it's associated with serious complications if uncontrolled or untreated, and blood glucose levels remain high. Some of the complications and how the disease can progress if not managed properly, it can lead to blindness, heart attack, stroke, lower limb amputation, and kidney failure. In 2010, the hospitalization rates for diagnosed diabetics were, for heart attack, 1.8 times higher for folks with diabetes than those without. Stroke, 1.5 times higher for diabetics. In 2005 to 2008, 4.2 million diabetics had retinopathy. And retinopathy is a problem that happens. It's damage to the small blood vessels in the eye, and it has to do with pressure and fluid due to diabetes. In 2011, diabetes was listed as primary cause of kidney failure in the United States. 228,924 people were living on dialysis or had had kidney transplants. In 2010, there were 73,000 non-traumatic lower limb amputations that were performed on diabetics. Okay, these are toes, sometimes feet, legs, okay, due to poor circulation, which is part of the disease, and non-compliant with medication and people not keeping their blood sugars under control. Other conditions and complications associated with diabetes: nerve disease, non-alcoholic liver disease, which is a type of fatty liver condition, hearing loss, erectile dysfunction, depression, gum disease or periodontitis, complications of pregnancy as far as gestational diabetes. Patient education and self-care practices are also important aspects of disease management. And when we're talking about treatment options here, we're going to first start with Western treatment options, because treatment for diabetes is very different depending on whether or not you're in the United States or other westernized countries, or you're in Asia or other places. So the treatment options for Western, patient education and self-care, they're the most important part, one of the most important aspects of care. And many people with type 2 diabetes can control their blood glucose by following a healthy meal plan and a program of regular physical activity, losing excess weight, and being compliant with their medication. There are many medications used to treat diabetes these days, and they come in both oral and injectable forms. Insulin is most commonly used to control blood glucose in people with type 2 diabetes, and there are several forms based on how rapid they act or how long they last. Okay, so there are short-acting, rapid-acting, intermediate-acting. Anyway, there are different types, and the doctors, the medical providers decide which type to give diabetics based on their blood sugar, their ability to control it, how much their disease has progressed, etc. And this is medication that tends to change over time. So oftentimes people can start out on oral medication but eventually end up on insulin and insulin injections. Monitoring blood glucose levels is critical since complications can arise from either hypoglycemia, which is low blood sugar, or hyperglycemia, which is high blood glucose. Early detection and treatment can reduce complications of diabetes and prevent progression. So high blood pressure and LDL cholesterol checks and monitoring to address heart disease, neuropathy, and stroke prevention. Okay, so a lot of times diabetics have to keep a regular check on their blood pressure and a regular check on their cholesterol, because all these things can compound the problems that go with diabetes. Regular eye and foot exams and smoking cessation is especially important for diabetics. So in the United States, it appears that obesity may play a significant role in the increased rates of diabetes. Now, this is due to this is testing through the CDC and mapping over decades as far as how we have changed over time and how obesity correlates with increased rates of diabetes. So it's important to understand that correlation is not causation. In other words, in research psychology, just because something appears to be connected to something, it does not make it the cause of the disease. However, it's a little hard to argue when you look at these numbers and these figures and the changes over time from 1994 to 2010. And if you start at the upper left, you notice in 94 that there were very low rates of obesity in this country, hardly any, and also in 94, correlated with that, very low rates of diabetes. Okay, so look to 2000, and you notice that the rates of obesity are increasing. I mean, we have states all the way up to 25.9%. Okay, and most of the states have some percentage of obesity by 2000. And diabetes as well, when you look down here, the patterns are pretty much the same. We now have increasing rates of diabetes, and the percentage has gone up pretty significantly since 94. Now when you get over to 2010, it's really not good. Most of the states, or a good majority of the states, are over 26% as far as the population that are obese, meaning a body mass index greater than 30, okay? And in 2010, the corresponding diabetes rates are huge. Okay, most of the states, or a lot of the states, are up in the 26% range or greater. We have no states anymore that have no rates of diabetes or negligible amounts. And so this really, even though correlation is not causation, it's hard to miss that these two seem to go hand in hand. Okay, treatment options as far as Eastern medicine. Okay, so in countries such as India and China, herbal medicines have traditionally been used to prevent and treat type 2 diabetes. Okay, proponents of herbal medicines cite better efficacy of the drugs, less side effects than Western medications, lower costs, and the ability to target multiple mechanisms such as insulin sensitivity, stimulation of insulin secretion, and reduction of carbohydrate absorption. Okay, they've done lots of clinical studies on these. There are several good resources out there. And some of the examples of herbal medicines for diabetics used in China and in India that have undergone clinical trials are ginkgo biloba, leaves from the G. sylvestri tree, mulberry leaf, fenugreek, Momordica, Charantia vine. It's a vine that grows. And I'm not even going to attempt this other one. Rhizoma coptitis decoction. It's a decoction made of this particular plant, berberine extract and ginseng. So they actually have clinical trials that they've done on a lot of these medications. Treatment specialists in the field of diabetes. For type 2 diabetes diagnosis and treatment of uncomplicated diabetes, any general medical practitioner or MD, physician assistants, and nurse practitioners can diagnose and treat uncomplicated diabetes. For lifestyle and behavioral modification changes, psychologists and medical family therapists are all folks who can help, who do specialize in treating and helping diabetics change and modify their behaviors and adjust their lifestyle. For disease education, RNs and LPNs are specialists in this. They deal with this in clinic all the time, and they are excellent at educating diabetics on how to use their medication, how to test, and things like that. However, when diabetes becomes complicated because of uncontrolled blood sugars or non-compliance with medication, it requires sometimes specialists in specific fields. So for metabolic functions, endocrinologists, renal functions, nephrologists, those are the kidney specialists who deal with diabetics who have renal failure, which unfortunately happens a great deal of the time. Retinopathy or problems with the eyes, those are ophthalmologists that deal with that. And heart health issues, of course, go to the cardiologist. And for stroke issues, internal medicine specialists. And unfortunately, when people wind up with amputations due to neuropathy problems and lack of circulation, then they will need to see a surgeon. There are psychosocial implications to type 2 diabetes, and a family history of type 2 diabetes, and we see this all the time in clinic, can often affect a patient's locus of control. Folks tend to adopt a learned helplessness attitude, and especially those patients with an extensive family history. They'll often take a very fatalistic view of their own health, and it's like, well, there's nothing I can do about it anyway. Grandma had it, Grandpa had it, Mom had it, Dad had it. I'm going to get it anyway, so why worry or try to change my diet? I'll just take medicine when I get it. And we do run into this in clinic a lot. Okay, that makes it a little interesting to deal with when you're trying to help people modify their behavior. So after a diagnosis of diabetes, patients often struggle with dietary changes that affect their social activities. So dinners out or at home with friends and family, sometimes that can change a great deal, especially if part of what you do when you go out is you're social or you're socializing or you're with other people. Maybe you have mild to moderate alcohol consumption, and you have to change all those things. Perhaps you and your friends have specific things you like to go out and eat, but they are things that are loaded with carbohydrates, and so you can no longer have those. So sometimes it does affect how you interact and change the way you interact with others. Dinners at home with family and friends, sometimes that's especially tough because a lot of times families bond over meals. It's in various cultures all over the world where that is a very important time. And a lot of times families have relatives who cook special dishes and it's their specialty and everybody looks forward to it and they get together, but it may be something that's absolutely not okay if you are diabetic and you're trying to keep your blood sugar under control. So sometimes it also changes the conversation we have with our families because sometimes people don't understand. It's like, well, I'd love to have Aunt Sue's coconut cream pie, but I can't. Oh, but you're going to hurt her feelings. Well, no, I can't. So sometimes we have to do some education within the family too so that people understand that we need to just modify how we do things a little bit. It does change spontaneity because where you could just pick up and go and do something before, you're going to have to plan now because you need to be able to take your medication, you need to be able to test, You need to have a snack if your blood sugar is low. And so it's something you need to remain mindful of. So people sometimes struggle with those changes as they're, especially when they're newly diagnosed with diabetes. There also may be intimacy issues that affect your interpersonal relationship or your relationship with your significant other. Because of the circulatory problems, sometimes medication reactions, and sometimes damaged blood vessels and issues like this can create challenges in intimacy. Decreased socialization is a lot of times especially noticeable. Patients can feel feelings of isolation, or they can feel stigmatized, and that always is accompanied by depression, and that may be due to other people's discomfort with their diagnosis of diabetes, or why can't you do what you used to do with me, and those types of things. There are spiritual and cultural considerations as well. And this slide's a little crowded, but I'm going to talk through this one a little. Spiritual beliefs and practices can affect important aspects of diabetic patient care in both positive and not so positive ways. Spiritual beliefs and practices can be extremely positive. They can provide the patient hope. It may be their source of strength. It may be a way for them to relieve stress when they pray or when they engage in activities related to their spiritual or religious beliefs. And they may also have additional support through their patient, through the faith-based community that they're involved with. Okay, spiritual beliefs and practices can also be concerning to healthcare providers. If a patient believes, especially if they believe they don't need medicine or medical treatment because God or their concept of a higher power is going to take away the disease. And this actually happens quite a bit in different cultures where people will say, no, I'm going to do prayer and that will fix it. And for some people that works and that's wonderful. But for other people, if it doesn't, then they oftentimes have a hard time going back to the doctor and saying, okay, I do need medicine. So spiritual beliefs and practices can be positive or they can be concerning, and it's something that's very important that we need to find out about our patients when we're talking to them and learning, and they're learning they have a diagnosis of diabetes. Cultural considerations can also affect disease management, and especially when it comes to food selection and options. So there are dietary restrictions in religious observances such as fastings. People who fast and pray, that can cause a very large problem with diabetes, especially if you're supposed to eat regular scheduled meals, which the doctors always tell people to do. And you can, if you're on medication, in addition to the fasting, you can really drop your blood sugar and have a hypoglycemic reaction and wind up in the ER. And it makes it hard for people, especially if it's a religious observance or something that they, feel very strongly about. So there are some foods that they cannot have for a specified period of time, perhaps, or foods that are to be avoided at certain times of the year. And this was kind of interesting. Foods avoided during certain times of the year, as far as Pakistanis go, they avoid what they call cold foods in winter, which is chicken, fish, and fruit, which if you're diabetic, those are things that are very good for you. They tend in winter to have what they call hot foods, which is beef and potatoes and things like that, lots of starch, so sometimes cultural considerations can really matter. There are also ethnic or regional food preferences and customs, and we know that here in the Chickasaw Nation because pashofa is one of the things that is traditional. And it is wonderful, and it tastes very good, but a lot of carbohydrates in pashofa. Asian American foods, sometimes there's a lot of breading, and we are in the South, so let's face it, deep fried foods, lots of starch, lots of fats, so there really can be regional food preferences and ethnic food preferences that affect diabetes. So I want to thank you for listening to my presentation today, and as I stumbled my way through some of it. These are some excellent references and resources for you. The Centers for Disease Control and Prevention, they're incredible. They put out a report in 2014 that covers really fascinating information on diabetes type 2 especially. So there are also in EHR, in Up to Date, there are some very, very wonderful articles when you can get to them that explain and are good for patient handout or information. And then Religion and Spirituality through Galati, that was good. And that really interesting article by Stuckel and Wong on the alternative medicines and different things like that, and Wang and Chan. These were all very good. Chronic illness, impact and intervention. So thank you and have a wonderful day.